So our case numbers, they've been low for weeks now. Even a small increase can appear significant to us. Do you think we need to be concerned?
I don't think we need to be concerned overall, but I think people who are unvaccinated should be worried. We've had about a doubling in the number of cases if you look at the 7-day average this week compared to last week. We're up a little bit over 100, and we've been down in the 50s in the previous week or weeks. So if you're not vaccinated, you are at risk for becoming infected with COVID.
Dr. Kyritsis, our vaccination rate is higher than nearly every other state in the union. So the question is, do you think it's high enough to protect us from a larger surge?
I think it's unlikely that we'll see a large surge, and it's great that we have such a high rate of vaccination, and all those vaccinated people should feel protected. But the people who are unvaccinated are where we're going to see this surge, and I think we could see a modest, medium-sized surge, particularly if people were gathering over the 4th of July holiday without wearing masks and without appropriate distancing and being unvaccinated.
Yeah, it's been a couple of weeks now, and that's what we usually see. So we've long known older people are more at risk for serious symptoms, even death from COVID. But your colleagues in other states say the patients they're seeing now are younger and sicker. Any idea why that's happening?
Well, I think what's happening is that the infection is becoming more common in younger people because they are the group who are mostly unvaccinated. They're much more likely to be gathering in groups without masks, and therefore more likely to become infected. The more numbers of younger people who become infected, inevitably the more serious cases we'll see, even if the proportion of serious cases in young people remains smaller than the proportion of serious cases in older people.
Is it the Delta variant that's driving the infections here in Massachusetts?
It's becoming more and more the Delta variant. There are so few cases that the proportions of Alpha and Delta and the different variants are hard to really estimate accurately because the numbers change week to week. But we have seen a steady increase in Delta cases as the number of cases from Alpha, which had previously predominated, are continuing to decline.
So given all of the branches, all the variants that are out there, what do you think the impact will be? Look into the crystal ball if you can. What do you think the impact will be on Boston hospitals over the next few months?
Well, fortunately, despite this little uptick in cases that we've seen in the last week or so, the number of hospitalizations continues to decline, even though the rate of decline is slowing a little bit. It's hard to predict the future, of course, but I would think we might see a modest uptick in hospitalizations due to infections in younger people who are still becoming infected because they're unvaccinated and unmasked. But I don't think we'll see a massive surge and a huge number of people in the hospital.
Dr. Kyritsis, thank you so much for your time. It's great to see you.
You're very welcome.